4 weeks of war in Eastern Europe and millions of people evacuating. We know many of you are eager to help.
We're joined this morning by Thomas Tighe, the president and CEO of the nonprofit Direct Relief. Thomas, thank you so much for being with us this morning.
Thank you for having me. My pleasure.
Thank you, Thomas. What supplies and medications are still most urgently needed in Ukraine and the surrounding areas where people are heading?
Well, I think everything you could imagine when you have, a quarter of a California equivalent moving around, fleeing, and over 3 million people fleeing. So there's the chronic needs that people need to sustain their health. Insulin if you're diabetes, inhalers if you have asthma, or conditions to treat your hypertension if you have that condition. So we have been asked and are providing a lot of that material to Ukraine, where we've worked for several years, but now it's a war as well. So I think a huge number of traumatic injuries, acute care for, in the targeting of hospitals, as many as 100 with the reports yesterday. So we've been asked to provide sutures, wound care. So we've got hundreds of thousands of bandages, dressings, wound care, IV fluids for the acute care. But really a lot of concern previously was just, so many people and just the needs, the hugely disruptive event for obviously Ukraine, but also the countries that border Ukraine that are receiving millions of people who are fleeing and also need help. So we're doing the best we can. We had an existing channel with Ukraine, and the state of California stepped up, and the governor and the Office of Emergency Services allocated a 50-bed facility that will be departing this weekend. That's been requested and approved by the Ukrainian officials. So that and things like oxygen concentrators, high demand. We've been able to mobilize about 1,000 of those and continue to provide everything we can once approved, and we make a logistics plan to get it there safely.
And Thomas, how are local organizations coordinating with Direct Relief to support these efforts?
Well, I think on state side, I mean, California and the state and other folks are being extremely generous, as are many of the companies. In Ukraine, I think we've been working with the Ukrainian NGO. When you deal with prescription drugs, you necessarily have to work with the government if you're bringing in, prescription drugs into a country. And with Moldova, Bulgaria, Poland, we're coordinating with the various ministries and then the local NGOs who are carrying a lot of the weight, as they often do here when there's a mass evacuation event. So it's kind of it's a pan-European event already. Really, our focus is on Ukraine for now, Poland secondarily, but really a lot of pressure coming on the bordering countries that are still developing their health infrastructure and now receiving, up to 5% of swelling their population by up to 5% in 3 weeks. So it's a unfolding high pressure situation just from the lens of health, not to mention everything else.
Well, Thomas, I know lots of people are feeling concerned because they might have chronic conditions too. They want to help. How can they?
I think there's a lot of organizations that do great things. Direct Relief is focused on that lane of health and medical, but I think, so directrelief.org is what you can learn what we're doing, but there's a lot of good organizations that do different things, and charitynavigator.org, that has kind of the compendium of all the groups with their ratings and transparency and all that sort of thing. So I think I recommend people look there, see what they care about, find a group that they're confident in, and if they're in a position to help, that's a wonderful thing to do. We really appreciate all the public support that we've seen. It's extraordinary.
Thank you.
Oh, all right, Thomas. Yeah, thank you so much for being with us this morning. We really appreciate your time and all your efforts. Keep up the good work.
Thank you. My pleasure.
And you can find more ways to help refugees on our website, cbsla.com. We continue our in-depth coverage of the war in Ukraine starting at the top of the hour on CBS Mornings.